What's up guys, Dr. Aaron McElhenney here with Revival Performance Physical Therapy, and today I'm showing you guys a great exercise for your back and your hip. So if you're having hip pain, you're having knee pain, ankle pain, back pain, this is probably gonna be a good one for you to try. So what you're gonna be doing is laying on your side. You're gonna be first activating your core because you're not gonna be moving through your lower back. Almost every exercise ever, you're activating your core, turning on that transverse abdominis, your built-in back brace. We've got other videos that go in detail on how to do that. Go watch those if you need to. You're turning on that transverse abdominis so you don't move at your lower back. And then with your leg, your top leg straight, you're just gonna be barely lifting that leg up and back down, up and back down. So making sure that you're not going too high to where you start moving through here. So if you go too high, then you're now doing a side bend and using that quadratus lumborum here and there's a time for that, but if you're doing that unintentionally as a compensation for weak hips, we don't want that. So you want nothing to move here. So this is staying in one spot and you're only moving at this joint here, using these hip muscles just like that. Another compensation a lot of people will do is they'll roll back like this, and then they're trying to use their hip flexors instead. Your TFL and hip flexors up here, just like that. So you wanna stay on your side. You can feel that pressure kind of on the bottom hip, that bony part, or kind of roll even better slightly onto the front part, just in front of that hip bone. So you're on that fleshy part, so it's not quite as hard on that bone. So you stay in that spot and you don't feel any movement at that lower hip and that bone right there. You don't feel it moving or rotating on there, and that's gonna make sure you're using the right muscles and to stabilize, and you're not accidentally using your back to do it. So bracing the core, bracing the hips there, and then just barely lifting that up, just like that. Another thing we don't want is you don't want it to be like a V here. You want to think about kind of bringing that leg. You'll probably feel like it's behind you, but if somebody were to look over you, it's more in line with you. So it doesn't have to be very high. So a lot of people, they try to get real high like that. Like I said, it starts using their back. So think about someone almost like you're reaching your foot out to kind of open this space up a little bit and keep that position the entire time as you kind of let your leg go back a little bit and just go up and down in that position. Not letting anything move at the pelvis, nothing moving at the back, only moving at the hip. This is gonna really strengthen those hips. I'd say do 3 sets of 15 a day, but really just go till it burns. And if you start losing form, stop. You don't wanna be encouraging bad habits, so just do it until it burns, take a break. Do it till it burns, take a break. Do that a few times a day to kind of start strengthening these hips, getting a better association of using the hips instead of the lower back. And you're just gonna be bulletproofing this area and not having any back pain. It still could happen, but then you need to contact a PT. So like and subscribe for more videos like this, and have fun.